Yes.
Hi, my name is Julia. I'm going to be your nurse for today. I'm going to go ahead and verify your name, date of birth. Perfect. Okay, I did hand hygiene when I came in. I also saw on your chart that you have an order to have your dressing changed and flushed, so I'm going to go ahead and do that. I verified the patient. My hands are clean. I do have this mask that I would like for you to wear. I'm also wearing a mask because I'm in the hospital. So I'll put the patient mask on and inform them that it's just best for preventing infections. I have my clean gloves over here. I'm going to get started on putting those on. Ready? Yeah. Okay, now that my gloves are on, I'm going to make sure that this is closed, and I'm going to go ahead and take off the dressing. I would stabilize the line just to ensure that it doesn't come out. Okay, hold that line still. I'm using the push-pull method. This is coming off quite easy, but using the push-pull method so I would not disrupt their skin. And I add that off. Okay. Go ahead and take these gloves off and do some more hand hygiene. And then I have my sterile kit for the cleaning, so I would open that away from me. I would grab the gloves over here at the cuff end and it's just touching the edges. I would open those gloves up and putting them on using sterile technique. Only touching the inside, making sure all my fingers get in there. Just touching it in. Okay, and that here, and that down. Okay, now that I have my sterile gloves on, I'm going to start by taking an alcohol swab. This is going to be used to go starting around the line, and I want to get rid of the dried blood or any discharge that they had. I would clean for like a minimum of 30 seconds, just doing a good thorough cleaning, do a little bit down the line, just getting the whole area set. Once I finish with that and it dries a little bit, I'm going to go ahead and get the chlorhexidine. I would pop it and use it in the same manner, cleaning it in circles, going all the way around, getting it nice and clean. Then I'd also follow it down the line to finish. Okay, now that it's clean, we let it dry. Say once it's dried, I would take the skin protectant and I would trace a border of where the bandage is going to be at to protect the skin from the adhesive properties. And then I go ahead and take this aspect, opening it away from me. Okay, touching it on the inside. I would take this off. I would kind of place it underneath the line. All right, once that's set, I would then take the protective barrier and open it. I'll put this where the line was visible. Making sure it cases the entire thing. Line it up. Removing these edges. My goodness. Remove that. Make sure that I push it all down. I place this up here so that I can date and time it. And continue to remove. All right, Once I have finished putting the bandage on, I am going to grab this part, making sure that it's closed, and remove. I would change that according to the policy. But as right now, I'm going to go ahead and clean the hub for 30 seconds. This would be obviously a new wipe. Let's grab the hub. Once it's been about 30 seconds, I'm going to go ahead and attach the saline. Attaching the saline. I would flush about 1 ml really slowly, and then draw back to make sure that it has blood, or make sure it has blood. I would also make sure that the site doesn't swell, there's no visible backup. And then I would also use the pulsation technique after I see that it flushes properly. I would do about 10 flushes per mil, and then as I'm doing it, I would slowly clamp it off to get the positive pressure. And then take that off. Get rid of the saline. This would be a new hub or a new cap for the policy, and then I would attach that. Making sure that this is still closed and the barrier, this is also closed, and everything is set. The patient feels fine. All right. If I had an order to remove the PICC line, I would then go ahead and verify the patient's name. I would let them know that I am going to go ahead and remove that PICC line for you. I would get them into a comfortable position, such as laying down. I would have sterile gloves on or clean gloves on. And then I would say, go ahead and hold your breath. Patient's wearing a mask, I'm wearing a mask. Remove the protective barrier like mentioned before. I would stabilize with one hand, and I would remove the line, pulling it out and then wrapping it around my hand, doing a slow but continuous movement. And as they're holding their breath, I would apply pressure with gauze and close off the area. Let them know to keep it on for at least 24 hours, but protect the area from any infections and to remain clean.